Welcome back to the PhysioNexus Biomechanics series. My name is Dr. Trent Harrison, and today we discuss the hand and fingers. Now, this is the first of a series of videos you can find in the specific playlist for hand and wrist. This channel is brought to you by PhysioNexus.org, the new physical therapy community and educational hub. If you don't know a lot about PhysioNexus, please either visit the website or watch one of our tutorial videos that describe it. If you already are a member, I'm excited to discuss cases and create more of the content you guys are asking for. Before we get started on this video, if you have not watched the Wrist Biomechanics episode, you can go ahead and click here and check it out. As always, here are our timestamps, general architecture and concepts, the palm, form and design, CMC, MCP, IPs, and then my closing thoughts. When looking at images of the hand, it can seem pretty complex. You got 19 bones and 19 joints, and that's not even including the carpals. So the interplay of how they work together can be a bit challenging to decipher initially. But before we get into the actual joints and how they work, let's look at the overall structure and function of the hand. Grabbing, grasping, pinching, these are the main goals. And if you want to design for grasping, there are some important elements to consider. First, you have to make sure that you have a nice hollow location for accepting an object. Then you want to be able to wrap around and hold that item with a strong sort of flexing grip. But in addition to that, when you perform this grasping, gripping, you want to make sure that the hollow space you've already created isn't compromised. So let's see how the palm area is created in order to do this. The hollow palm has the thenar eminence laterally and the hypothenar eminence medially. Between that, you have a recess that can be described by varying arches and the four creases of the hand. Now, these creases, which are often cited in palmistry and fortune telling, do serve a purpose. These areas are where the skin has fibrous attachments to the deep structures and fascia of the hand. This is one of the ways that the hand ensures that the palm remains hollow, regardless of the position it takes. And this is similar to the creases you see in the fingers, where the skin is tethered to the interphalangeal joints. One way you can see how these fibrous attachments maintain the palm is when you place your hand flat on a surface. Your contact points will be the thenar, hypothenar eminences, the metacarpal heads, and then the phalanges. But if it's a flat surface and your hand is flat, your palm won't touch. Now, when the hand goes to grip something, there are multiple arches that are in effect. Transversely, you have the carpal arch and the metacarpal arch, also known as the proximal and the distal transverse arches. The center line of these two arches are the lunate and the third metacarpal, kind of splitting up the hand. Now, longitudinally, you have four arches that are created by the combination of certain carpals, metacarpals, and the phalanges, and we'll go into these groups in just a moment. We're going to describe them more as zones, functional zones for movement. Then obliquely, you have the arches of opposition, the most important of which is the thumb and index, coming across like this. The most extreme would be the thumb all the way to the pinky. Now, looking back on those longitudinal arches, we have classified these as three zones of prehension. Zone 1 is the thumb. This zone is by far the most important functionally because it has the ability to then oppose the other fingers. It's part of the reason the thumb is positioned anterior to the palm. We'll get into more details about the biomechanics of the thumb in a later video in this series. Zone 2, the middle and index finger, this is the area of precision. When you pinch with this against the thumb, for instance, the index against the thumb, that's a bidigital grip. And when you use all three, that becomes tridigital, which is one of the most widely used types of grips, whether it's with a fork, with a pencil, chopsticks, whatever. Zone 3, the ring and the little finger, this is the power grip region. These fingers come into play to ensure the strength of a full palmar grip or a firm grip. Let's give some landmarks and some normals for what you should be seeing from an overall big picture of hand and finger movements. First, what happens at the palm when you're doing these things? When you grip, you create a palmar gutter. Okay, this runs obliquely throughout the hand. It runs from the base of the pisiform of the hypothenar eminence through the lifeline and out near the second met head and the thumb. Laterally, it's bordered by the thumb itself. Medially, it's bordered by the index finger all the way to the pinky. And I guess you could say posteriorly, it's bordered by the arches that are created obliquely by the thumb and each finger individually. This is the basic structure of the hand when doing any sort of grasping task. Now, what about other reference points? What about for normal positioning? Say when I'm doing the observation portion of my examination, where do the fingers go generally? Where do they point? Well, if I want to look at the hand when it's spread, if I put my hand up and I spread my hand, even my thumb, they create these lines that converge, roughly they should converge about the scaphoid tubercle. Now, also it's important to clarify what I'm doing, what motions am I performing with the fingers, and what is the position that I'm seeing. You see, abduction and adduction technically is based off of the midline of anatomical person position. So therefore, some think that you don't actually perform abduction and adduction of the fingers, but instead you're separating and approximating them. And this is in reference to the third finger, that they are separating and approximating to the third finger itself. With that means the third finger, it's not going to separate and approximate, it's going to abduct and adduct relative to midline. Others think that the third finger is the midline of the hand and that the second, fourth, and fifth are going to adduct and abduct in reference to the third finger. And in this scenario, the third finger can't adduct since it's the reference point, so instead it's going to abduct medially or abduct laterally. And for the sake of this video, I think this is a cleaner way of describing it, that this is adduction and abduction of the fingers. Now going back to how the fingers move, let's look at what happens when someone makes a fist, for instance. Now to highlight what's occurring, make a fist, but keep the distal interphalangeal joints extended. You'll see that if you had a line extending from each point of the finger, they all kind of converge at the radial pulse. And this is important because it shows how the fingers become more obliquely aligned as you move from the index to the pinky or lateral to medial. We'll show how this occurs when we get more into the structures of the joints. Let's start with the carpals and move up towards the distal phalanges, and on the way discuss concave-convex rule and the available range of motion. Initially, we will start with the carpals and discuss how they interplay with the metacarpals in three sort of structural longitudinal columns. The most lateral and most important comprises the scaphoid, traps, the trapezium and trapezoid, in addition to the first and second metacarpals and their respective phalanges. Now the second metacarpal articulates with the trapezoid primarily, but secondarily it articulates with both the trapezium and the capitate. This makes it very secure. The next column is the intermediate, and this is the lunate, capitate, and the third metacarpal and the phalange accordingly. And then the final column is the medium one, which is the triquetrum, hamate, fourth and fifth metacarpals, and the phalanges. Now the fourth metacarpal, much like the second one, it's going to articulate with, yes, the hamate, but also the capitate. Now the pisiform doesn't transmit any forces because it's anterior to the triquetrum, so we don't have to classify it into any of these particular columns. So what are our concave-convex rules for these columns? We've already discussed the relationship of the proximal and the distal role in the wrist biomechanics video. So let's start with the carpometacarpal joints. So the second, third, and fourth CMC joints are considered planar joints, whereas the fifth CMC is sometimes discussed as a saddle joint. You see, the fifth CMC, it's got an unusual angle to it, and that's going to affect its range of motion and function when trying to perform any sort of straight sagittal plane motions. Now, there's not much motion at the CMG joints in general, but what motion does exist to help move the metacarpal heads and create that sort of hollowing palm position. At the more distal transverse arch, you have the heads of the metacarpals, and they lie, when you're lying your hand flat, they're going to all be existing in the coronal plane. When you perform a hollow palm position, the heads of the metacarpals, specifically the medial three, are going to move into flexion. Now, the second metacarpal, it's going to barely move because its base is so bound to that trapezoid. However, each carpal after it will move with an increasing range of motion, with the fifth metacarpal moving the most. The fifth metacarpal also not only moves anteriorly, but also slightly laterally, and this is because of the axis of the fifth is actually in two planes. It's halfway in the coronal and halfway in the sagittal, and this means that the axis is sitting obliquely to the rest of the hand and the palm. So if you are willfully trying to move the fifth metacarpal towards the palm or in the sagittal plane, you're going to get some flexion, but also abduction because of those component motions. Now, in terms of carpometacarpal range of motion, we can mostly consider these all one degree of motions, that being flexion extension. The second and third CMCs, they practically have no range of motion. It's very minimal and they're very tightly bound. The fourth, it's going to have flexion extension axis and it's going to have perceivable motion, but you're not going to really be able to measure it. And then the fifth is also going to have perceivable motion, not a ton to measure, but it's going to have that saddle joint, so its degrees of freedom are actually abduction, adduction, and flexion extension. Now conceptually, you can think of this as the second and third CMCs in essence create a stable base for the fourth and the fifth and the thumb to move around, and this allows for this finger opposition to occur. In addition, what little motion they do produce results in a lot of osteokinematic important motion and excursion at the metacarpal heads. This is how the distal transverse arch is able to be flexible and yet still have a lot of stability. Continuing to move distally, we have the condyloid metacarpal phalangeal joints, which have 2 degrees of freedom. That's going to be flexion extension, and abduction and adduction. The metacarpal heads, they're bioconvex, so we have a concave convex rule here. In addition, we can note that it has a wider margin posteriorly. To match this, the phalange has a base that is bioconcave and is considerably smaller than the metacarpal head. What I mean by that is that the metacarpal head has about 180 degrees of available articular surface, whereas the phalange has only about 20 degrees. Now, typical flexion of the MCP is just short of 90 degrees at the index finger, and it decreases out to about 110 degrees when you get to the pinky. In terms of active extension, you have about 30 to 40, but passively you can get up to 90 degrees. With abduction, there's more total range of motion in the second and then the fifth MCPs, and considerably less in the third. Abduction can reach as high as 25, adduction about 20. Of all the fingers, the index finger in particular has the greatest arc of abduction and adduction combination. Now, currently we are just discussing range of motion possibilities and bone structure, but it will be highly important to understand the ligamental and connective tissue structures in this area to fully understand the MCP joints. For instance, if you abduct your fingers while in an extended position, you have a large range of motion to work with. However, if you were to flex your fingers just at the MCPs and then tried to abduct the fingers, it's significantly limited. And we'll discuss 2 hypotheses for this, one of which deals strictly with the soft tissue. Another important factor is the third plane of motion resulting in rotation at the fingers. This is because the condyloid joint, which usually doesn't allow for rotation, but because of the asymmetries of the metacarpal head being wider posteriorly, and also the different pulls of the collateral ligaments, there's this automatic rotation towards the direction of supination that occurs as you flex the MCPs. And this is highly noticed specifically in the 5th metacarpal joint. When we get to the interphalangeal joints, we have the proximal interphalangeal joints, or the PIPs, and then we have the distal interphalangeal joints, or the DIPs. These joints can be considered hinge joints with 1 degree of freedom, that being flexion and extension in the sagittal plane. The phalanx is broader anterior on its head, and this gives the distal phalanx more of a surface to work on, which factors into its overall motion. The PIP has increasing flexion as you go from the 2nd digit out to the 5th digit. At the 2nd, you have about roughly 100 to 110 degrees of flexion, where the 5th digit has approximately 135 degrees of flexion. The same is for flexion of the DIP, the 2nd digit having about 80 degrees and the 5th having up to 90 degrees of flexion. In regards to extension, it's roughly nil for both actively. I mean, you might have up to 5 degrees actively of the DIP. And this makes sense if you look at the difference in the design of the metacarpal heads versus these phalangeal heads. The metacarpal head had a large posterior articular surface, whereas the phalangeal heads, this does not exist at all pretty much with the PIPs and only slightly with the DIPs. But if you look at passive extension, things change a little bit. The PIP still has nil, but the DIPs can be passively extended about 30 degrees, even though we described no other motions occurring also at these joints besides the sagittal plane. The DIPs also having this extra play in them, you can have some slight mobility to the sides, abduction and adduction. Now next on our docket for when it comes to our videos, we're going to be moving into the actual motions themselves, particularly flexion. What are all the soft tissue limitations? What are all the muscles that are interplaying here? And what are the ligaments involved and how do they dictate the motion that's going to be occurring at the joint? If you have any questions, please don't hesitate to get active on the forums on physionexus.org or message me directly here in the comments section. We look forward to seeing you in the next video.